Welcome to my channel Brainies. Today we are going to discuss about the topic Rancho Los Amigos scale and also Rancho Los Amigos pediatric level of consciousness scale. So let us just first deal with the Rancho Los Amigos scale, shortly been abbreviated as RLAS. It is also known as Rancho scale, and it is a widely accepted scale, a very famous, reputed scale, which is used to describe the cognitive and behavioral patterns of the brain injured patients. This scale was originally developed by the head injury team at the Rancho Los Amigos Hospital in Downey, California, which is used to assess the patients emerging from a coma. The main uses of RLAS scale, it is used to understand a brain injury patient's abilities, impairments, and prognosis as they move through the various stages of recovery. Not only that, it facilitates communication among the various healthcare professionals who is dealt in treatment plan of the patients. The various stages of the Rancho Los Amigos scale are as follows. It is also known as the cognitive functioning scale. So we abbreviate it as level of cognitive functioning scale, LSFS. It is LCFS. So the various stages are as such. Level number 1, there is no response. Patient does not respond to any of the external stimuli and mostly appears asleep. Level 2, which is the generalized response, patient reacts to the external stimuli in non-specific, inconsistent, and non-purposeful manner with a stereotyped pattern and limited response. Level 3 is the localized response. Patients respond specifically and inconsistently with delay to the stimuli, but patient may follow simple commands as well as for motor action. Level 4, it is the stage of confused and agitated response. Patient exhibits bizarre, non-purposeful, incoherent, or inappropriate behaviors. And patient doesn't have the short-term recall. Attention span will be very short and non-selective. The next stage is level 5, which represents the stage of confused, inappropriate, non-agitated response. Patient gives a random, fragmented, and non-purposeful response to various unstructured stimuli. But however it is, simple commands are followed consistently. Memory and selective attention will be impaired, and new information cannot be retained by the patient. Level number 6, confused, appropriate response. Patient gives an appropriate context, goal-directed responses, depending upon the external input for direction. There's a carryover stage for relearned, but not for new tasks. And recent memory problems also persist. We'll move on to the next stage, that is level number 7. This stage is referred as automatic appropriate response. Patient behaves appropriately in familiar settings and performs the daily routines automatically, and patient shows the carryover for new learning at lower than normal rates. Sometimes patient initiates the social interactions, but judgment remains impaired. Level number 8, it is the purposeful and appropriate response. Patient appears to be oriented and responds to the environment, but the skill of the abstract reasoning abilities are comparatively decreased relative to the pre-morbid levels. So let us just deal with the mnemonics for RLAS, that is Rancho Los Amigos skill. Here is the mnemonic. So the mnemonic is, as the stages indicates, level number 1, no response. Level number 2, generalized response. Level 3 is the localized response. Level 4 is the confused and agitated. Level 5 is confused, inappropriate. Level 6 is confused, appropriate. 7 is automatic, inappropriate. And 8 is purposeful and appropriate. So this can be correlated with the mnemonic, no girl likes clumsy cricket cap. So N stands for no response, girl for generalized response, L for localized response, clumsy is confused and agitated, and cricket, confused, inappropriate, cap, it is for the rest of the three stages, confused, appropriate, automatic, inappropriate, purposeful, and appropriate. So that's it, the mnemonic for RLAS. The next one, we are going to discuss about the Rancho Los Amigos pediatric levels of consciousness scale. The Rancho Los Amigos pediatric level of consciousness scale, shortly being referred as Rancho Pediatric, is specifically designed for use with children and adolescents. The Rancho Pediatric can be used in any setting, whether the child is in hospital, rehabilitation center, home, or school, wherever it is, this particular scale is applicable. Knowing the child's level of consciousness, that is LOC, is a key to understand the child's cognitive and behavioral skills, and which may help to determine the further assessment, intervention, and educational plan. So most of the children appears to be alert and physically able, but may have a reduced LOC, that is the level of consciousness, and may not be able to consistently remember what has happened earlier during the day. That is what time of day it is, what is planned for tomorrow, what has happened the previous, the previous hour, all those things, they tend to get fatigued easily. The Rancho Pediatric is not a standardized assessment, but however it is considered as one of the rating scale that provides a framework for describing the cognitive recovery process. LOC is determined by informally assessing the child's ability during the daily routine activities to provide the information for planning, assessment, treatment, and programming. So the various stages for Rancho Los Amigos pediatric level of consciousness scale. Level number 1, which represents oriented to self and surroundings. It provides an accurate information about self, and they are being away from the home. They know very well where the toys, clothes, and other objects are kept. They actively participates in treatment program, recognizes their own room, ways to bathroom, nursing station, etc. Not only that, they show active interest in toys. They watches over the other children who are playing and gradually try to mingle among themselves. They initiate social contact with an adult, enjoys socializing. So this is about the level 1. The next level is level number 2, which demonstrates awareness environment. The child will be able to follow simple commands, refuses to follow simple commands by shaking their head saying yes or no, imitates the examiner, that is who is assessing the patient, imitates the examiner's gestures or facial expressions. The child responds to name, recognize the mother, father, and the immediate family members. Also enjoys the imitative vocal play. The next is a level number 3, gives localized response to sensory stimuli. The child blinks when a strong light crosses the field of vision and follows a moving object passed within the visual field. The child turns towards or away from a very loud sound, gives localized response to painful stimuli. The next is level number 4, which indicates it gives generalized response to sensory stimuli. The child gives generalized startle to loud sound. And the child responds to repeated auditory stimulation, either with increased or decreased activity. It also gives generalized reflex response to painful stimuli. Level number 5 is no response to stimuli. There is complete absence of the observable change in behavior of the child to visual, auditory, or painful stimuli. That's it with Rancho Los Amigos pediatric level of consciousness. I hope the video is comprehensive. Thank you for watching. Kindly support by subscribing and sharing. Thank you once again.